Hello, my name is Bonnie Essner. I'm a pediatric health psychologist at Lurie Children's Hospital in Chicago and an assistant professor of psychiatry and behavioral sciences, pediatrics, and medical social sciences at Northwestern University, also in Chicago. The title of my talk is Awakening the Mind, Healing the Body, a Mindful Approach to Health. So over the course of the next few minutes, we have a few objectives. I hope, first of all, that you'll learn a few benefits of mindfulness that have been found for people with chronic health conditions. Also hope that you'll learn a couple of mindfulness practices that have evidence for improving health and well-being in people with chronic conditions, and also learn just a few ways to integrate mindfulness into your own life. So I think, the best place to start when we're talking about mindfulness is to understand a little bit about its evolution. Mindfulness, contemporary mindfulness as we know it, again, in healthcare settings, where most people encounter mindfulness for chronic conditions, really has its origins in Buddhist traditions and Zen meditation practices. Around the 1970s, those practices, there was more opportunity and interest in learning about some of those ancient traditions, and they were really brought more to the Western cultures by several, now famous Buddhist monks and secular teachers. Again, mindfulness has really been adapted, and many people encounter it as it is now in these brief kind of semi-standardized programs that have similar components that are taught to people really to help them to cultivate some mindful awareness. They can be delivered and people can learn about mindfulness really in some freestanding wellness programs or through psychological treatment are some of the most common settings. So now that, we kind of talked about the evolution and where mindfulness comes from, let's, kind of give it a definition. So mindfulness, really at its essence is a way of being. It is a form of awareness. Probably the most common quote, the most common way to describe mindfulness is from a famous instructor, Jon Kabat-Zinn. He called mindfulness a way of paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So to break that down, all the elements, first of all, on purpose. So really attending to and putting our focus and our attention onto internal signals, our thoughts, our emotions, things that are happening in the moment, in us and around us. Again, in the present moment, so what's happening now, so not processing or dwelling on the past, not anticipating the future, but really attending to what's happening in the moment. And also non-judgmentally, which means having an attitude of curiosity and of interest without judging, again, any of our thoughts, anything going through our head, any of our emotions as good, bad, worthy, but really just getting an getting an understanding of what's happening ourselves. I also like to contrast mindfulness with being on autopilot, which is kind of what mindfulness is not. So many of us have this experience of being on autopilot, going through a task, maybe even going through a whole day and really kind of losing track and not even knowing what we were doing, just kind of grinding through. Mindfulness really is kind of the opposite. It is paying attention. It's really taking in what's happening and in a very observant manner. And the purpose of mindfulness really is to cultivate this enhanced awareness, this connection with the present moment. We know that mindfulness can have many benefits for practitioners, but we're not striving for anything or any outcome in particular. It really is this cultivation of these skills and these attitudes. So, now that we know, again, kind of what is mindfulness, how do we do this? How do we practice this? How do we cultivate mindfulness? There are several ways. First of all, seated practices are things that people are often quite familiar with. mindful movement, such as yoga, Tai Chi, where we bring mindful awareness as we move our body in gentle ways, and also everyday mindfulness. So really intentionally bringing mindful awareness to some of the activities that we do on a daily basis, such as things like, mindfulness of eating or mindful walking. It's also important to point out that, mindfulness has been shown to have benefits for people with a number of chronic conditions. So at this point, there's evidence that mindfulness can really benefit people with diabetes, digestive conditions, cancer survivors, just really a number of conditions. And also that mindfulness really can be adapted for people of all ages. Children, teenagers, young adults, middle-aged, and even older adults. There are ways to really practice these skills and kind of bring mindfulness, again, into the daily lives of people really across the lifespan. So, how does mindfulness, again, kind of benefit, or what really are some of the benefits of mindfulness? Well, first of all, there are a few physical benefits. We know that people who practice mindfulness can find that they have reductions in pain, fatigue, and other uncomfortable symptoms over time. There are cognitive changes that people report, so improved attention is one. Emotional changes like reduced anxiety or improved emotion regulation, and then also improved social connections with others as well. So mindfulness is not magic. We know, again, with really strong, rigorous research, that there are a few different ways that we can, that mindfulness kind of cultivates some of these benefits. It really seems to shape how people interpret those sensations in their body. It also seems to really change the way that people are perceiving the sensations. And it also can change how much people are actually bothered by body symptoms. So to illustrate this a little bit, I'd love to tell you a little bit about a patient named Rosa, who I had the real privilege of working with, knowing kind of in a healthcare setting. So Rosa was an educator who had a really fulfilling career. She was the mother of 2 children and was very proud of that role. And her breast cancer diagnosis really took her by surprise. It was a challenging time in her life for all of the reasons. Getting through chemotherapy really felt like an immense accomplishment. And when she finished, she was so ready to just get right back into her life. But there were definitely some challenges. Rosa had ongoing pain, fatigue. She really described that she felt so burdened by some of the daily things that were difficult now that, hadn't been so much in the past, things like caretaking and just really parenting and being with her kids. And so in the course of really at following her breast cancer diagnosis, Rosa did get connected with a therapist in the healthcare setting. And within that treatment, she really found that she benefited from some mindfulness practices that the therapist introduced and described and practiced with Rosa. So much so that then Rosa sought out other mindfulness skills opportunities and joined a group mindfulness class that was actually offered within the same healthcare setting. She was practicing multiple times a day at times, and also just kind of finding simple ways to really bring mindful attention, kind of into her life. And it wasn't always easy, but really over time, she credits mindfulness and this kind of new way of really understanding and reflecting kind of on herself and on her experience as being so beneficial for her. So, how do we incorporate, where do we go if we're looking to really learn more about mindfulness? I like to break it down into a few different ways. There are kind of guided, kind of synchronous, in person or in the moment ways to learn mindfulness or to practice it. And then also probably some self-led approaches to accessing mindfulness. In terms of the guided practices, as I've already said, many psychotherapies integrate mindfulness practices within the treatment for those people who are seeking psychotherapy. Group-based mindfulness practices, like I've already described. And then many healthcare settings offer online, either drop-in or set mindfulness classes as well. For this more self-led mindfulness opportunities, there are apps that many of us have heard of. There are also some nice online kind of one-off and then also kind of online series of mindfulness classes and practices, and also some nice workbooks as well. So in terms of building a lasting practice, kind of getting started, but also building a practice that we can sustain, a few tips that I like to recommend are, first of all, really to start slow. None of us would be able to practice for 2 hours of seated meditation a day. We need to start slow and to kind of get used to the practice, find what works for us, and then build up. Expect that there will be some challenges. Mindfulness really is a practice and it's a commitment. And it takes time to kind of learn these things and integrate them. Allow the practice to really unfold. Kind of start with foundational practices and then kind of build up over time. Really lean into that curiosity and know again that there may be some ups and downs. Really embrace the reflective components of mindfulness. And also find ways to make mindfulness a family practice or commitment, or practicing with others as well. So thank you so much for having me. And I hope that this was just a small introduction to the benefits of mindfulness for people with chronic conditions and how to integrate it into your own life.
Hi, I'm Amanda Wentworth. I am a yoga therapist at the Vanderbilt Center of Integrative Health. I'm here to share with us today about yoga therapy and the importance of state change in the healing journey. So at my Osher Center at Vanderbilt, we have a therapeutic yoga team. And we are here seeing patients in group settings, one-on-ones, and research. And we are basing our work in the yoga Krishnamacharya lineage of his son TKV Desikachar. And you often will hear this called the style of Vini Yoga. So I just want to start off with the question, what is yoga therapy? Yoga therapy uses techniques for body, breath, mind, perspective, and emotions to shift a person towards balance and health. But how do these techniques really work? We're going to do a practice, have an experience of this, and check in afterwards. To begin the practice, please just be comfortably seated. Eyes open or closed at any point. Begin making the whispered sound ah each time you exhale. The jaw nice and relaxed. The vibration smooth and steady, comfortable. Next time you breathe in, raise one arm just as far as feels comfortable to you. Whisper ah as it lowers. Ah. Then do the other arm. Continue at your own tempo of breathing. Each breath in, the arm goes up. Each breath out, whisper ah, and the arm lowers. It's important to go at a tempo comfortable to you, not too fast, not too slow, and time to your breath. For the last couple rounds, lower your arm a little more slowly each time. Your sound is still comfortably long and smooth. The sound synchronized to end right when this slow lowering of the arm completes. Maybe about one more time. And then you can remain seated a moment, eyes steady or closed, and check in with how you're feeling. Do you feel any different than you did before? What qualities or sensations are present in body, breath, mind, perhaps even emotions, how you're feeling right now? That completes the practice. Okay, so just going back over the practice we did, short, simple, followed by a check-in. Check-in, what is your state of your system right now? Did you feel different than how you were when you began? Specifically, how do the body, breath, mind, perception, and emotions feel? What qualities and sensations are present? So if you felt different, if you feel different now after the practice, likely there's been a change in your state, what we call state change. Techniques of yoga therapy are intentionally designed to positively change an individual's operating state towards balance. Our defining text in yoga, the Yoga Sutras of Patanjali, describes balance as the following. In body, balance is steady and comfortable physically. In breath, the breath is smooth and long. In mind, the mind is stable and focused. Perception, clear and positive. Emotions, maybe towards equanimity and peace. So this might be the change that the state is moving towards. I just want to give an example here of the work we're doing at Osher. I have a yoga therapy class that's meeting students with chronic pain. It's a practice paired with information and discussion from a nurse practitioner. The practice we did today is very similar. Definitely modified to individual needs, whatever's going on in the system. Maybe the arm doesn't move as far, or you're moving some other part of the body if the arm is uncomfortable. And we follow it with a check-in and a self-report time. In general, always hear people feel more calm or relaxed, that their personal pain and symptoms have diminished or they've become less loud. And they report an increase in confidence in personalized tools they can use in everyday life for shifting their pain experience. A recent report in my class, actually, a couple days ago, a patient said, I had a functional neurological disease flare start just before class. Now my symptoms are gone, and it usually takes hours to maybe have this kind of relief. So just to conclude, for yoga therapy, its benefits in the healing journey, it allows for an experience of state change, which can shift how someone's unique system is functioning. This shift towards balance improves system regulation, health, and vitality. And yoga therapy provides a personal and experience-based therapy for one to engage in their own unique integrative healing journey. Lastly, just to conclude, thank you. And to find out more about what we're doing at our Osher Center with yoga therapy, I've put the website. We're currently working on an online library of resources, including written practices and video practices to try like this. And you're welcome to explore all the services we have through that website there. Thank you again.
Hi, my name is Samantha Sharp. I'm a family doctor at the University of Wisconsin Department of Family Medicine and Community Health, and it is my pleasure today to talk to you about hypnosis and your health. Next slide, please. I have 3 objectives. At the end of my presentation, my hope is that you will be familiar with hypnosis as a treatment modality, that you will understand how hypnosis can be used to modify symptoms or suffering, and to learn how to find skilled hypnosis practitioners in your area. Next slide. All right, so let's start with some vocabulary. What is hypnosis? All hypnosis is self-hypnosis. That's the most important thing that you should know. Hypnosis is a relaxed state of inward attention where distractions that are around you fall away and you're more open to suggestions. You remember everything that you hear or see or experience. You're not asleep, you're not awake. Sometimes people will use the metaphor of a magnifying glass focusing sunlight, where your mind is very focused on just one thing, and you're able to get the ego out of the way and get yourself to a state that is more relaxed and focused and suggestible, but always in control. People have said that hypnosis is a way to improve communication between the mind and the body, or an intentional daydream. Hypnosis is often met with suspicion because in movies and books, hypnosis is inappropriately described as mind control, where someone is controlling another person. But that's absolutely not what hypnosis is. Hypnosis is self-hypnosis, and I can say that confidently because hypnosis hinges on relaxation, and there is no way for one person to force another person to relax. Next slide. Here are some alternative labels for hypnosis. Maybe you've seen these. In my opinion, I feel that they are the same as hypnosis. Next slide. All right, what is a trance or hypnotic state? I will often say that if hypnosis is a river, trance is the water, meaning that trance happens all the time. One example is hypnosis, but if you get lost in a book or are daydreaming or go into a flow state while you're working, if you lose track of time or do your best thinking while you're in prayer or on a walk or working on a puzzle or dancing or driving, these moments are examples of being in a trance. With hypnosis, we're getting to that trance state on purpose with the intention of making some changes. And in the session, I teach my patients how to do it themselves so that they don't need me to get to that state. Now, a trance is not fragile. A trance is not magic. If someone can do an Ironman in a trance, and if a surgeon can perform surgery in a trance, and if a woman can give birth in a trance, that means that they are able to talk and react and respond just like they normally would. And so, given these examples, I bet you're thinking of times right now when it happens for you, because it happens for all of us. Next slide. Okay, so let's say that you are meeting with someone who does hypnosis. What can you expect? First of all, when I'm meeting with a patient for the first time, we talk a lot about what they want to change. We spend time getting comfortable with each other, building trust and rapport. I learn about them. I learn about what they like and what they don't like. If there are places in nature that they're very comfortable with or comfortable in or just feel a connection to. I want to know what they're proud of. I want to know what senses are strongest for them. Like, do they have a very strong visual sense or olfactory sense, so that we can kind of use all of those skills to make an experience that is unique and powerful for them. I educate people on hypnosis, just like I am right now, so people know what to expect. When we begin the session, we start with an induction. An induction is usually some breathing exercises, often with your eyes closed, but it doesn't have to happen with your eyes closed. And then we do deepening, which is deepening the relaxation. That might mean counting down from 10 to 1 or 5 to 1. It might mean going down a staircase or down an elevator. There might be a body scan or progressive muscle relaxation. In a first session, I may or may not do trance ratification, which is when I'll have the patient do something to prove to themselves that they are in a trance. For example, I may have them hold out their arms and imagine that they're holding a heavy bucket in one hand and balloons are tied to the wrist of the other hand, and notice how that feels different. The work of hypnosis happens after this, where we're doing imagery work or making suggestions or affirmations to make whatever change this person is looking for. This is often in the form of stories or metaphors. There may be imagery, affirmations like I mentioned. And for pain-related complaints, we do all kinds of things. There might be colors and dials and levers and buttons and dimmers to change that sensation or experience. Sometimes I'll say, if a creature were causing your pain, what animal would that be? And then we find ways to make that animal go away. After that portion of the session is done, then it's time to re-alert. It's time to come back to the place and time where the session began. And so that might involve going back up the stairs or going from 1 to 10, or just feeling your feet on the ground and your body in the chair and opening your eyes back to this place and this time, alert and ready to continue with the day. And then we debrief. We talk about what their experience was like, what they liked, what they didn't like, and what we might do next time. It may be that you only meet with whoever you work with just once, but for me, the majority of my patients see me 3 or 4 times. And the reason for that is for people to have a variety of recordings, because after the first session, we'll make recordings that people can listen to at home. And it's also a chance to kind of fine-tune whatever sessions we've done before. And so that is a reasonable expectation, to be seeing someone a few times. Next slide. Great. So this is a list of conditions that can be helped with hypnosis. These are things that have research behind them. And so the area of medicine that has the most research for using hypnosis is irritable bowel syndrome. But all of these symptoms that I have listed here, IBS, functional abdominal pain, the hot flashes and night sweats that come with menopause, symptoms of labor and labor pains, warts and other derm complaints, preparing for surgery or chemo or radiation, athletic performance, particularly for the injured athlete, quitting smoking, building confidence. These are all things that I see all the time for hypnosis. And it's really important that whoever you see for hypnosis knows how to manage these issues outside of the setting that you're working with them. So I feel like as a physician, I can really help with the physical symptoms and suffering that many people are dealing with. Next slide, please. Okay, so the previous slide talked about issues that can be helped with hypnosis. This is the how. How can it help? And before I go into my bullet points, I just want to take a minute to admire the athleticism of Michael Jordan in this picture. I feel sure that Michael Jordan was in a trance in his best games. And this picture comes from a magazine article, and the title of the article is "Thinking Ahead of the Game, How Elite Sports Stars Have the Ability to Slow Down Time." And you know how they're able to slow down time? Is trance. So over to my bullets. During labor, hypnosis can be helpful to reframe contractions as waves that are bringing you closer to your baby. It can, you can imagine that there is a warm, numbing blanket that goes from the abdomen, just over the fundus of the uterus, all the way down to numb any sensations that one feels. We may talk about time distortion. This is something that we could use in labor, but this is something my mom used when she was getting radiation, where those unpleasant times move quickly, and then those resting times move slowly, kind of like an accordion. In trance, one could talk to a trusted coach or a guide for advice. You could visualize being successful in high-stakes situations, in exams, in speeches, in athletics. I had a man who wanted to see me because he didn't want to cry at his son's rehearsal dinner when he gave his speech. And so we worked on that a lot. A chance to practice skills that feel overwhelming in real life. This is a great opportunity for exposure therapies for phobias and for improving athletic performance. Next slide, please. All right. So if hypnosis sounds like something that would be really powerful for you, the place to begin to find someone is through the ASCH Find a Member tool. ASCH is the American Society of Clinical Hypnosis, and they have people in every state who are skilled at doing hypnosis. Now, Psychology Today also has a really powerful Find a Therapist search engine, and they have a box that you can tick for hypnosis. And so that would be another place to find a skilled therapist. Now, if unfortunately there isn't a therapist in your area, the next bullets are recordings that I feel comfortable recommending. Health Journeys is a business that was started by Belle Ruth Naperstek. She has some beautiful recordings about all kinds of things. And you can listen to samples of those recordings and buy them at hayhouse.com. I have no skin in that game. I don't have any connection, but I do think that this is a good resource. Healing with Hypnosis is another website to check out. Hypnobirthing is the company that was created for using self-hypnosis during labor. I use this myself. They do have like remote classes, and they also have information of where to find local classes. And then the next three bullets, the Nerva app, the Finito app, and the Evia app, these are all apps, obviously, with recordings for IBS, smoking, and sleep and vasomotor symptoms of menopause, respectively. So this is a great place to get things started if you feel like hypnosis could be an effective tool for you. Next slide. This is the end of my presentation. Thank you so much for your attention, and I look forward to your questions.
So I meditate daily I do it a little bit differently. I have a help of a nap. I still experience a lot of pain when I go to sleep because of my neck and my back, but I can practice some breathing, and it really helps me to get to the point where I can fall asleep.
I hear somebody cough and it starts to get me worked up. I just immediately start doing the breathing. And then I notice a breeze or I notice a bird. And then everything starts to work together. And in that moment, which is all we have, I'm not concentrating on the negative.
I won't be the best meditator in the world, but I am a nature girl. So my meditation is really being out in nature. I'm also a bird watcher. I go on long birding walks. I go on hikes on the beaches and the bay and the mountains. And I just kind of let nature be my meditation.
Things like yoga might be kind of woo-woo for people, but it really helps. Meditation really helps.
I think what I was most amazed with that I didn't think that I was going to like was the hypnosis, the hypnotherapy. It really transported me to another place.
Osher does self-hypnosis for pain, which was new and super helpful for me.
And mentally, I'm doing much better. Physically, I accepted. Through the acceptance and commitment, I really honestly think that it could unlock happiness for so many people that are just locked in thinking that they're never going to get better.